A federal health agency is warning about a wide racial gap in exposure to the AIDS virus. To talk about projections by the Centers for Disease Control are two guests, the executive director of the Multicultural AIDS Coalition, Gary Daffin. Also with us from the coalition is the program manager of Connected Boston, Amir, Dixon. Thank you both very much for being with us.
Thank you for having us.
Gary, go over this again about the kinds of disparities, because even if we're just talking about samplings among gay men, the racial disparities are really almost off the charts.
Yeah, I mean, it's just confirming what we've known for a while, which is that Black and Latino men experience HIV infection at a much higher rate than white gay men. And over the past few years, 5 or 6 years, we've been seeing HIV infections go down a little bit among white men, but continue to increase among Black and Latino men. And particularly young Black men, we have seen the fastest rising group in the country. And it's mostly young men who are under 24. So, and people under 25, under 35 make up the vast majority of new infections in that population, among that population. But it's young men who are 13 to 24 who aren't connected to services, who don't know about their HIV status, and who don't know how to get tested or to really talk about preventing HIV for themselves.
Amir, you're working with this population. Tell me a little bit about them, about the barriers to closing the gap.
Yes, so at Connected Boston, again, which is a program of the Multicultural AIDS Coalition, we work around treatment and prevention specifically for Black and Latino MSM, men who have sex with men. For a lot of our clients, in talking about HIV, we have to center structural barriers, right? So thinking about housing, thinking about access to health insurance, thinking about access to comprehensive, safe community health centers, thinking about underemployment. These things create barriers for them in looking at treatment and prevention, right? So if there are loopholes and there are hoops that they have to jump through just to get to see a doctor, these are barriers that are created. And I think that as providers and service-based providers, we have to do a better job of creating direct access for both treatment and or prevention.
Gary, what about the disparity here? Because I'm sort of reading between the lines. It's race, it's class. I think in the middle class there's more acceptance of different sexual orientations. Right. I imagine where there's less acceptance, that means people might be less connected to the community too.
Yeah, I think people are less willing to talk about their sexuality, so they're less likely to disclose to their doctor that they're having sex with men, and so they don't get information that could be just basic information that the doctors could provide. But what we do know is that Black men are not having more sexual partners, they aren't doing more drugs, they aren't taking more risks. There actually a lot of studies have shown that they're trying harder to prevent themselves from getting HIV. But because people of any race tend to have people with the same race, their social networks are tighter, smaller, and so the more people who have HIV, the more likely it is that they will come in contact with HIV. And so there are some factors that make it just more probable that people will come in contact with HIV, and if they don't have the proper information or the materials that they need to protect themselves, then they're going to more likely get infected. So it's not that they're doing anything different or not trying really hard to stay negative, but there are environmental factors, structural factors that are simply making the odds against them.
Amir, I guess one thing you need to encourage people to do is to get tested, probably.
Mm-hmm. Yeah, so I definitely agree. I think that it's important to encourage people to get tested. But I just want to back up and extend on something Gary was just talking about. I think that when we're thinking about HIV and we're thinking about the high rates of young Black gay men and Latino gay men as well who are getting infected, we have to look at HIV in our communities as a social justice issue, right? Because there's racial inequality, economic inequality, barriers to employment, which then you get health care, and then you're able to go and access a doctor, right? You're able to go and access treatment and prevention, right? So there's PrEP, pre-exposure prophylaxis, which is a once-a-day pill that prevents HIV. But for many folks in our communities, they can't access that because of all of these other barriers, right? So I think that we have to look at it as a social justice issue. And I also think what's imperative is that we are looking at innovative strategies, right, that are ways of preventing and treating HIV. And what that means is, what I hear from clients oftentimes is we need extended testing hours. We need to have readily available prevention methods, right? And we need to be looking at ways that folks are able to get into treatment and also get prevention tools readily available to them.
Gary, what about some of the ways you can prevent this? Because I heard there even maybe some kind of a shot you can get that could at least diminish the odds of getting infected.
So yeah, I think what's really important to remember about this new report that 1 in 2 black gay men will become infected throughout their lifetime, that's if we don't do anything. And so we do have a lot of tools that can prevent that from happening. So one of them is making sure that people do get tested, get into care, and get their viral load suppressed. In that case, it's very hard for them to transmit the disease, almost impossible. Then there's PrEP, as Amir mentioned, which is a new once-a-day pill, which is essentially using HIV medication with negative folks, and it prevents folks from getting infected. And basically, as long as you take the pill every day, all the studies show that no one who's done it has gotten infected, except for one very rare case that we know about, but it's almost 100% effective. So that's another way. The other thing is that people need to be getting into comprehensive services and staying in services. They need to be getting tested for STIs regularly. They need to be able to talk to their partners about sex and about their HIV status. We need to normalize that. We need to take away the stigma around sex, but also particularly around talking about HIV, talking about STIs. We need to just make it a matter of course. But yes, we do have a lot of ways to end the epidemic, and it's really something that we can do, particularly here in Massachusetts, where we have seen a much higher success rate at getting people in care and getting their viral load suppressed, meaning that they have HIV under control. We do much better than the rest of the country, but we do still have a ways to go, particularly among black gay men and Latino gay men. But we do better than that. We also have reduced the number of new infections over the past 10 years to, I think the latest numbers that I've heard is around 600 a year, which still means we've got a ways to go, but that's half of what it was 10 years ago.
Amir, if anybody wants to get in touch to get more information or get any kind of help, what's the best way for them to do that?
That's a great question. So you can find us at connectedboston.org. You can find us on Facebook at Connected Boston, also Twitter, Connected Boston. And also call us directly. You call us, I'm going to pick the phone up, 617-238-2424.
And Gary, anybody who wants to get in touch with the coalition, there's a place they can do that as well?
Sure, just call us. We have a website, mac-boston.org. You can also call us at 617-442-1622.